for joining us.
Alrighty, so I think we'll maybe just give people one more minute to join before we really dive into some good content. We were told we should be able to see if there was a viewer or two out there, and so we're still figuring out some of the technology behind Facebook Live.
Right, we're rookies at this.
Yeah, we've maybe given a presentation before, but nothing with Facebook involved.
Right.
So.
We have some great information to share, so I'm really hoping some patients get online and can see what Grace Health has to offer. Because this is a great center for patients who need health care, and we know healthcare is quite expensive, so our goal is to talk to you about some ways that you can save and utilize Grace Health.
All right. Yeah. I think it's a good time to get started and just do the formal welcome and thank you for tuning in with us here today. It's such a beautiful summer day in Battle Creek. So happy to be here at Grace Health, happy to be talking to everybody. And so today's discussion is we're going to talk to everybody about affordability and access as well. They kind of go hand in hand. And what a better, I feel like this topic, affordability, is so timely. Cost of living, inflation, it's everywhere. You know, the gas prices, they're haunting us daily. And the last thing we want to see is for somebody to have to make a choice between getting health care or filling up their gas tank, for example. So my name is Carrie Nelson. I'm the Director of Pharmacy here at Grace Health, and I'm joined by Chris Higdon.
Hi, Chris Higdon, Director of Patient Accounts.
And so with that, we just want to talk to you all a little bit about what Grace Health has to make healthcare affordable.
Okay. Can you start?
Yeah, why don't you go ahead, Chris?
All right. We here at Grace Health offer a program that you could be eligible for a discount on any service here at Grace Health. Who doesn't like a good discount? I'm one for a sale any day. But getting a discount doesn't mean that you're getting less care. It's the same great care we provide everyone, but with a lesser cost to you. Grace Health is a federally qualified health center, but we are not run by the federal government. It just means we are qualified to receive a grant from the government to help those who are uninsured or underinsured. The out-of-pocket cost to you is based on your gross income and family size. So there's some questions that you may have, and I'd like to answer these questions. But just like, what is gross income? It's easy to confuse gross between net, but gross is gross is the money that you earn. Net is the money that you get. So the gross is the wage you earn before any taxes and other deductions are taken. And the net is what you actually see in your paycheck. We look at the gross income of those in the household and the number in the household to determine your cost per visit. The discount scale is based on the Federal Poverty Guideline, which is posted in the Federal Register every February. The discount scale is broken down into 4 categories, A, B, C, and D. It's based on your income, where your income falls, and the number in your household. So if someone is listed in your household and is employed, we would need their proof of income to qualify. Another question might be, how do you prove your income? The most common method is using a paycheck stub or printout of your income for 2 consecutive weeks. We would then double that income to come up with a monthly income. Another great way is a copy of the most recent W-2 for the year, or the first page of your income tax, federal tax form. So for medical services, the discount ranges from a $5 copay to a $40 copay based on where you fall in your category. And the dental services, the discount ranges from $25 to $45 a visit.
So Chris,
yes.
I don't want to interrupt, but
that's fine.
If I just heard you correctly, if I bring in the proof of income, say I live by myself, so I'm the only person contributing to the household, if you will, and I apply and I'm approved for the sliding fee discount, the most I might pay for a doctor's visit is $40 if I'm approved.
Yes, absolutely.
$40. Okay.
Absolutely. Yep.
That's not too bad.
No, it's
for a doctor's
wonderful.
visit.
It's wonderful.
Mm-hmm.
There are some specialized services that have a different rate of discount, such as, the dentures, root canals, crowns, eyeglasses, IUDs, and surgeries that require an anesthetic at the hospital. So for some of the more expensive services, we may ask you to apply for Medicaid. And you may not know that anyone can apply for Medicaid, and it's really easy online. It's just a real quick Google search, how do I apply for Medicaid online? And it should bring you up to a website from michigan.gov/mybridges. There you can go and you can start an application. Sometimes that can be intimidating to people, and you may need some more support. We do have assistance here at Grace Health, and all you have to do is call our patient account department and ask for an appointment. We'll schedule an appointment, and we'll walk you through just how it is to enroll in Medicaid. So I guess probably the biggest question right now is how do I apply for the discount? We have a simple application that can be found on our Grace Health website, or you can stop in on site at our West Building. We have a patient account department right in the West Building, just right off the lobby area. But when you complete it online, it's really simple. The application is a one-page, very simple application. I'm not sure that you can see this, but it's very simple. We ask for your name, your address, your phone number. We ask if you receive income, your date of birth, and then everyone in the household. So it's a real simple application. Again, you can find it online, and to find it online at our website, you go to the gracehealthmi.org, and on the very first page, you scroll down and there's a place that says patient forms, and you just look for the discount, and it's right there. You'll see a template that you can actually fill out online. You'll save it to your computer, and right on the application, it will give you an address where you can email the application and your proof of income. The discount can be used if you have insurance. The discount would be taken off your copay. So let's say you have Blue Cross Blue Shield, and you have a $200 deductible, and your office visit gets applied to your deductible. You can still apply for this discount. It is solely based on your income and the household size.
I feel like that's probably something that people don't realize. It's an assumption. Well, I have insurance, so I can't apply for the discount. It doesn't mean that you're uninsured if you have our sliding fee discount. You can have insurance or not.
Right.
Everybody's eligible potentially to at least apply.
Right. Mm-hmm. And the grid, to give you an idea of based on income, for let's say a family of 2, a monthly income, if you bring home, or if you gross, and again, that's before taxes are taken out, if you gross less than $3,050, that is your gross, you could be eligible for a Category D, which again, it is based on your, it could be, oh goodness, I didn't have my quotes here, could be again, $40. instead of your $200 deductible. So it's great. So it's based on your family size, and that's really important, and your income.
And income is a really loose term too,
It
because
is.
that's dollars you bring in from work.
Yes.
It's also
Child support,
yeah.
workman's comp, pension if you are retired. That's one of the things about our senior population. They are really good. They know exactly how much they bring. And so sometimes it's really easy for our senior population to apply for this discount because they know exactly how much they're getting from Social Security. And so it's, like I said, I don't want to stress it, it's very easy to apply. So when you complete the application, it's typically good for a whole year. But there are times when we may give you a little less time span based on your financial circumstances. It could be you're laid off, but you anticipate going back to work within the next few months, or you know you've got a job starting in a couple months. We're here to help you get through that gap. So the discount, you may have to pre-qualify a little bit sooner on certain circumstances, but for the most part, it does last for a whole year, and you would then have to re-qualify. So one of the biggest advantages of applying for the discount is the great savings on your prescriptions. Our patient account team works really closely with the pharmacy. We're close in proximity, and we work a lot of times if we are qualifying someone for their discount, and we talk to them about their prescriptions, and we send them straight to the pharmacy. Just the pharmacy can help them. So I don't know if now would be a good time for you to talk about what the pharmacy can offer.
Absolutely. So a few years back, the leaders here at Grace Health, they recognized a need that was missing. We didn't have an on-site pharmacy, and so important because many of our patients, they take a bus route here, or maybe even on a day like today, they would walk here. And so they'd come and they'd see their doctor and they'd need a prescription filled, and they'd have to figure out a way to get to the next pharmacy a few blocks up the road, or maybe even across town. And so back in 2018, they made the decision to invest, and we opened the pharmacy doors in May of 2018, and full service pharmacy for a community setting. And it's just, it's grown year after year, it's grown. And part of it is because of the affordability of our pharmacy and all of the different resources we have available. So that's what I want to spend some time right now, is to talk about those resources. And we're here for the patients, we're here for the community as well. We are just an extension of Grace Health under the same roof, and providing that same care with that same mission, of course, our mission being to provide patient-centered healthcare with excellence in service quality and access. So with the pharmacy growing in size, our team has grown as well. It's made it easy to provide good care. We've got a staff of 5 full-time pharmacists, 8 technicians, and we're still growing. Just like the rest of America, we're hiring for pharmacy technicians. So if this sounds like something you think you might enjoy, hey, come talk to me, give us a call. And we also have a full-time delivery driver, so I'll talk about our home delivery program. And so I just want to make sure that everybody out there knows that the pharmacy is open for the public. It's not just just our patients that we serve the community as well. And we're open Monday through Friday, 8 until 7. Many people think that we close up at 5, we only fill prescriptions for our providers, and those are both not true. We accept, of course, our sliding fee discount. That is something that we're required to honor. And but we also accept pretty much every other major insurance plan out there. So come see us, come talk to us. And the majority of our services are available for everybody, whether you're a patient or not. But there are a few things that are specific for just our patients. So like Chris had mentioned, the sliding fee discount. So after you stop by and talk to the enrollment team, and you've got a prescription that you need to have filled, you come on over and you see us, and we can fill your prescription at a discounted price. There's a lot of pharmacy discounts out there. There are pharmacies that have $4 lists, which are just select medications, right? They've got maybe 5 pages and just a handful of medications that are pretty inexpensive that they can sell for that $4 price point. And there's also discount cards out there. I see them in offices, I see them in newspapers, online. And the trouble, like, to compare all of the discounts that are available, I love our sliding fee discount. It applies to every drug. Some drugs are very affordable. I'll give you a very easy example. EpiPens, something that hit the news a few years back for being hundreds of dollars, and prices were skyrocketing, and you know, people couldn't afford their EpiPen, which is a life-saving medication. Patients that are approved for our sliding fee discount, it's a $4 medication, $4 copay. So
That's incredible.
it is.
Yeah.
It's a great discount. So certainly better than the discount cards you might find online. And I'll be honest with you, as a consumer, those terrify me, because if I use one of those, maybe GoodRx, that seems to be pretty popular around here, the pharmacy is required to send out all of your personal health information with that transaction, and that just makes me so nervous.
Right.
The last thing I want is for somebody's name and birth date and address and phone number and medications and provider and all that just going out to some unknown server.
Yes, absolutely.
So our discount is wonderful. Insulins, there are many insulins that are at that $4 price point. Blood pressure medications, of course, cholesterol, diabetes, antibiotics. Like that, for our patients, it's a wonderful discount, and we regularly ask patients to step on over and talk with the enrollment team because the discount is so wonderful. So the other thing that our pharmacy does specific for Grace Health patients, which makes things pretty affordable, is we do free antibiotics and prenatals. We want to make sure that patients aren't needing to go to one pharmacy just to get a single medication for free. Makes it harder for the pharmacy to do their job, honestly, to screen for those drug interactions and check for dosing, and if you're having prescriptions at multiple places. So as often as we can, we want patients to stick with a single pharmacy to keep things simple. So we do offer those antibiotics and prenatals for free. And so those would be specific for Grace Health. Everything else that I have to talk about is for anybody, whether you're a Grace Health patient or not. Something that's maybe overlooked, except for those parents out there, is flavoring of medications, liquid medications.
Oh my gosh, that was a lifesaver.
Yeah, there's no extra additional cost. So if at any point somebody wants their antibiotic or maybe their steroid or cough medication flavored a little bit special, we can do that without any sort of extra cost.
What kind of flavors do you have?
Oh my gosh. So I've seen certainly bubblegum and watermelon. Those are probably the top flavors. We have apple, which is surprising to be a little more popular. Grape, lemon, if you've got a little sour toddler on your hands, we can throw some lemon in there perhaps. So that's something we just do, again, for free.
Great.
Our pharmacy is a site for one of the red med boxes. So it looks similar to an old-fashioned mailbox where you can throw away your prescription medications safely. And so that's a really nice service. And it's most medications. So any sort of tablet, capsule, anything you might put in your mouth can go in the box. We want to make sure that people know you don't want to put sharps in that box.
I was going to ask.
Yeah. That's the one thing that definitely shouldn't go in there.
Right.
That's a safety issue. So another free program we have that I just hinted at earlier is our home delivery program. And it is free, yes. We always get that question, is there a cost associated with getting my prescriptions delivered? No. And our driver does not expect a tip either. And it's really quite simple. If you contact us, or maybe your doctor contacts us and says, hey, we need this delivered, we take it from there. And so we deliver anywhere in the Battle Creek area. Right now we have a 15-mile radius, which is advertised, but to be honest, we've stretched that a little bit because there's definitely some need out there, in particular now with gas prices being so expensive. So we go 15 miles around the Battle Creek area, and then we also deliver to Albion. That's a community that we have a dental site here, Grace Health Services. So we drive out to Albion a few times a week as well. And it's not limited to just delivering to your home. We've made some deliveries to some of the schools, actually. Some of those 18-year-olds, older students, they can have their meds delivered if needed. We've delivered, of course, to places of work, so we can meet you on your lunch hour somewhere. And we've even delivered to the shelters, which is a great service. Right. And so at this point, we're doing on average about 15 deliveries a day, which is why we've got a full-time driver. Yeah. If there's a copay, we handle payment in one of two ways. We can either take a card over the phone, and that's processed the day of your delivery. We don't do anything in advance. So that way, if something comes up and you don't need it delivered or you're going to be on site, you can handle payment then. We also will take check at your home too. So that's nice. Alrighty, so more talking about affordable health care. Our pharmacists, the 5 of us, we're available on demand to meet with you one-on-one at any point. We do appointments with our patients every day. We offer anything within a pharmacist's range, so we will do teaching about inhalers, injections, just kind of sitting down with your list of meds and just giving it a real good analyze and make sure that everything is coordinated well. Also just talking about the details with them. How should they be taken, with or without food? Time of day, should they be spaced apart? What if I miss a dose? So all of those are really great pharmacist questions that we love to answer. And so again, sitting down with the pharmacist, right, that's a free service, which is good because sometimes it's hard to get in to see your doctor. Right. And you've got a question that you'd like to have answered sooner than later. So a newer service that we'd like to talk about is our personalized medication packaging. And I brought an example of what that looks like. So instead of getting a whole bunch of bottles perhaps filled throughout the month, we can put a day's medication in just a single pouch for you. And then, so exciting. Yeah, so if it's a little bit hard to maybe organize your meds or maybe you can't remember if you've taken them or not, that's where these pouches are outstanding. So simple, they just tear off and then you tear them in half, and instead of having to open a whole bunch of bottles every day, right, you're opening 1 or 2 packs in the morning or at bedtime. So these are a wonderful service. That's definitely a growing service for our pharmacy too. So what else can I talk to you guys about when it comes to affordability and just having good overall care? I got to tell you, there's so much value in just being in close communication with the rest of the Grace Health staff. So whether that's a question on your sliding fee discount, or maybe it's a question on your patient plan that you received from the doctor, or maybe you just don't know when your next appointment was scheduled. That's one benefit that our pharmacy offers, as well as just added to the grand scheme of things. I also wanted to talk a little bit about our over-the-counter meds. This is, again, something for anybody in the community to take advantage of. We have a pretty large selection of over-the-counter meds that you can just purchase. And I brought some examples. So because it's kind of allergy season in Michigan, we're still early summer, late spring. Cetirizine or Zyrtec, you can get a bottle of 100 tablets for $6.36. Claritin or Loratadine, a box of 30 for $3. Wow. I thought, vitamins, that's pretty popular. And for all of the moms with some younger babes at home, the vitamin D drops that you have to give them once a day if you are breastfeeding, a bottle for $4 out the door. Wow. And then we've got calcium and vitamin D right now in stock, 300 tablets for $8.50. So And we've got, your Tylenols and your aspirins and ibuprofens, and we've got your mentholatum rub and all sorts of itch creams because it's that season as well for $1 or $2 a tube. And again, when it comes to affordable health care, come see us at Grace Health. That's what we're all about, is making healthcare affordable.
Absolutely.
If I haven't said enough, our pharmacy is unique in some of our partnerships as well. So if somebody comes to our counter and even though they've got a pretty inexpensive medication, a $4 EpiPen, for example, and it's still out of reach, even at $4, it's just too much. We can help. We can take it one step further. We've got a team here at Grace Health, the resource specialists, and part of what they do, just a fraction, is we can call on them when somebody needs help with their prescription copays. And so they will meet with somebody one-on-one and just see what's going on, ask them a couple of questions, and if it seems necessary, we will help with that copay. We also have a partnership with the Salvation Army here in Calhoun County, and so if somebody has ongoing need or maybe a little more extensive need, we can notify Salvation Army or give information to you about the Salvation Army and what they have to offer and help with some of those prescription costs as well. And Salvation Army, that's a great partnership because besides prescription or healthcare costs, they can also help with some other things as well, cost of living, housing, and just, they would have more details on that, of course. So, and lots of information, lots of good things that we have here at Grace Health. And this, I love to see the folks that are listening live because you have the advantage of being able to ask us some of your questions right now. But if there's something maybe a little bit too personal, you're always welcome to give the pharmacy, give Grace Health, give Chris's team a call, and trying to work through the details together, of course, because last thing we want is for somebody to ask a question that's a little too personal, or maybe that just can't be answered very well live on air. And the other thing too is for the folks that are listening live and maybe they know somebody who could benefit from hearing this information, this is being recorded and available on our Grace Health Facebook page as well. So
I do have a couple of other things I just wanted to point out because the sliding fee discount, it's just I'm just very honored to work at a center that focuses on the patient and is able to give discounts to patients who need it. There's some other great advantages, not only of pharmacy, but Grace Health, if you have the discount and you get your labs here, you will get a bill from the Bronson Hospital because they do their own billing. However, if you have the discount, they will honor our discount. So you don't have to do any more paperwork. So you want to make sure if you have our discount that you get your labs done on site here at Bronson. The less paperwork is always better. Some of the questions I thought you may have, may not be thinking about it, but so what happens if you show up and you don't have your proof of income? We here can utilize what we call a grace visit, and we will give you a discount for that visit. Unfortunately for the medical and dental, it is just the one time that we can do that. But pharmacy, I believe you offer that once a year.
We do. Yes. Yeah. That is written in our policy because you don't get sometimes that expiration date kind of sneaks up on you, basically. You've been refilling your prescription month after month and you don't have an office visit coming up anytime soon. Chris's team sends out notification when that expiration date is coming up, but when you come in and if you just all of a sudden maybe you started the process and you're not quite done with it, it's a good little safety net to be able to use what we call a grace visit. And that's just it, is you continue to pay for one more time the discounted price on what you have.
Because we all know life happens and time can get away from us, and so we definitely work with patients on that aspect. So Another question I thought you might have is, what happens when I don't qualify for the discount, but I still need medical care? Please don't put off your health care because you can't pay for it. We have a team here on site that will work with you. If you get a bill from Grace Health, and you don't have to pay it all at once. I want to make that clear. If you have a $100 bill from Grace Health and you just can't pay that $100, it's okay. You know, you can break it down. We have patient financial services counselors who will talk with you. They'll work with you regarding the budget plan. But what we don't want you to do is put off your critical health care for financial reasons. That's why we're here, and that's important to us.
A little bit different in the pharmacy world.
Yes, it is.
Of course. Pharmacy, when it comes to billing, it's a great thing, but it can also sometimes be a challenge.
Yep.
And so when it comes to billing, pharmacy is real-time billing. So when that situation comes up in pharmacy where, again, like, don't put off your health care because you can't afford it. We've got Salvation Army relationships, we've got our resource specialist teams. We will figure out a way. Maybe we need to reach out to your doctor and find a cheaper alternative. That happens from time to time. So Chris's team does a wonderful job with managing and pay as you can, pay as you go. So again, just bottom line is, don't put off. I've got a great story. So very early on, when the pharmacy was just getting started, a patient came into our walk-in hours back then, and you could tell it was about this time of year, you know, and it was spring, the pollen was going, and just this awful sinus infection. And so you could tell, you know, she put off going to the doctor as long as she could until she just couldn't take it anymore because she was afraid of the cost.
Right.
And when she came back over to the pharmacy and her doctor had sent in 4 prescriptions, you know, her antibiotic and her steroid and her cough medicine and inhaler, because again, she was...
Must have been bad.
It was bad. She cried happy tears because with her sliding fee discount, it was less than $20 for everything.
Wow.
And I assume then her doctor's bill at the end, she probably was all right financially. So
that's awesome. I love to hear stories like that.
Me too.
So what about the homeless population? You may know someone that's homeless. We work really hard with our homeless population, and we'll give every benefit of the doubt as far as if you know someone that is homeless, there's no charge at all. We will waive your copay because you're homeless. You need to focus on other things and outside of having to pay for your health care. So when you're truly homeless, that's one thing you don't have to worry about here. You had mentioned about the resource specialist. I want to just tout them as well, because they work with patients in many ways without regards to health care, because we're here, we provide great health care, but we do have resource specialists that will work with, especially the homeless population, for housing and where can I get food, and it's just a great service. I think we need to suggest they do a Facebook Live someday.
They would be great.
Yes, they would.
They'd have information to share, I'm sure.
Yes. But you know, we know healthcare is expensive, but you know, Grace Health is here to serve as a safety net. We don't want any patient to go without care because of finance. Again, as I mentioned, patient counts is really easy to get to. We have a very easy phone number to remember, 441-3456.
Yep.
And you can even ask questions on our portal. We really encourage that. So you can ask questions at midnight. We won't answer at midnight, but we will get back to you as soon as we can.
I feel like we've tiptoed around this, but haven't come right out and said it.
Right.
Grace Health, as a health center, we cannot turn you away simply because you can't afford, or you think you can't afford, health care.
Absolutely.
We're obligated to see you. Now, there are some times where maybe we may not accept somebody because
Right.
there's other options in the community.
Right.
So if somebody has just a traditional commercial insurance, for example, with no extraordinary needs,
Right.
they may not get to be seen right away because
Right.
we're here, as Chris said, as the safety net. We want to make sure anybody who might be turned away at other establishments, they get health care here.
Right.
That's our goal. Yep.
Another thing, that if you don't have insurance, and you want to know how much your bill is going to cost, you absolutely, and by law, have a right to have an estimate. If you don't have insurance, you want to know, all you have to do is call and just say, hey, I would like a good faith estimate of how much it's going to cost me. And we are, putting processes in place where we can automatically do that for you. Right now, we just ask that you call and ask for what we call a good faith estimate. We'll do our best to help you understand the financial piece of your Grace Health visit. Yeah, that's really all that I have. So if you have any questions, feel free. Again, reach out to us. You can put your question in the chat box. And again, that's what we're here for. We're ambassadors for Grace Health. We thoroughly believe in our mission, and
yeah, especially, I can't say that enough as a pharmacist. It's all over all the time about the cost of healthcare, the cost of prescription medications, and the thing about being here at Grace Health, that burden, if you will, is kind of lifted off of our shoulders.
Right.
We have just so many resources in place to help with affordability.
Right. We're a nonprofit agency, so we're not here to make money. Well, we obviously have to meet our costs, or we have to meet salaries and things of that nature, but we are not here to make money. That is not our goal. It is,
It's community
needs, absolutely. Oh, I see we do have one question. Do you provide medication packaging in the pharmacy?
Yeah, we definitely do. So the med packaging, I can talk about a little bit more. So if somebody is interested in medication packaging, there's a lot of different ways that some pharmacies will do medication packaging. And we opted to do the pouch type version. But if somebody would be interested, the first step is just say so. Hey, I heard you guys do med packs. How can I see, or what do I need to do to get more information on that? We sit you down with a pharmacist, and you spend anywhere from 10 minutes to an hour. It depends on how many meds you take, honestly. And they do a medication interview, basically, where they sit down and they really get to know you. They get to know how you take your meds. They ask you, is this something you take in the morning? Do you take this by itself or with other medications? And so, depending on who you are and how many medications you might take, if your meds allow it, maybe you only take meds once a day, and you just want to make sure that you get them all each time and you don't have to open up 6 bottles in a row. And so in that case, you might get, say, 30 of the pouches, where you just have to take 1 pouch a day. I love how these are so portable too. Easy to throw in a bag if you're going over the weekend somewhere. And they're labeled with your name and the contents, so they meet all those legal requirements, so that if there's ever a question, or if for some bizarre reason somebody needs to know what's in your pouches, they can figure it out really easily. It's very safe. And so you sit down with the pharmacist and they talk about how you take your meds, and they get them all synced up as well. Added bonus, right? So now, instead of coming to the pharmacy once a week, you're coming once a month to pick up all of your medications, and they're organized exactly how you like them. At the same time, we're double checking that the meds can be taken together. So that's another, again, added bonus, because there are some times when medication shouldn't be mixed at the same time. Thyroid, good example. Those thyroid medications, certain vitamins and other meds can interact with those if they're taken at the same time. So we make sure that doesn't happen. So there's so many benefits to the medication packaging, the organizing, the safety, just having a pharmacist who actually knows you
Yes,
and
yes.
actually knows your medications. That's
This
pretty
is
priceless.
huge.
It is.
I wish we
It
would have
is.
had this several years ago when my mom would take 18 pills and, having to put it all spread out. That was horrible. So, gosh, I think that's huge. And I
Yeah.
really hope that the patients take advantage of that.
Yeah, especially because again, it's a free service. There are many other pharmacies that would charge
Right.
because this is more cost. Of course
Right.
it is, but and just the amount of time that goes into putting all these and making sure they're just right. There's a lot that goes into one of these little boxes to make it just personalized to you.
Right.
And besides these medications, if let's say you take something besides what's in the box, maybe you use an inhaler on this side, we'll make sure that gets filled at the same time too. So it truly is a med sync one-time fill,
Right.
one-time stop in the pharmacy. Some of our favorite patients are the ones that just take advantage of everything. They use our home delivery, we do the med packing. We've got really good relationships with a lot of our patients because of it. So, so med packaging
I
is
noticed that
wonderful.
you've got a glucose monitor and strips.
I did. I brought all sorts of little toys with me, right? So, something that maybe I should have spent a little more time on earlier is our diabetes program here. And, just working in healthcare, diabetes is a hard condition to manage, right? So, because you're talking office appointments and not just doctor appointments, you're talking
Vision, foot care,
dental, like the whole body. There's a lot of things to keep an eye on in diabetes. And so, besides the office visits, medications, diet, exercise, labs. People forget about all the labs that go into it, and it's both, coming to a lab, but then also home labs where you're checking your sugars. And so putting it all together, it's a lot. It's a lot to have to manage. One thing, Grace Health has been putting a lot of resources into how to better manage diabetes. So something the pharmacy has been doing is if you use our pharmacy, you get your testing supplies for free. Period. It's very simple. It makes it simple for you, the patient, of course, because you're going to one place. You're going to the pharmacy for your meds. You're going to our pharmacy for your supplies, and you're not having to call maybe a mail order supply shop. You're not having to fill out any extra forms because of it. It makes it a lot easier for the staff here, the clinical staff, the medical staff, because instead of, again, having to fill out a lot and send this here and send that there, it all comes to our pharmacy. And then it's easier for my team as well from a billing aspect, because when you give something away for free, it's pretty simple. You just hand it over.
Free.
Free is free. Doctor sends over a prescription just like they would anything else, and so that way we know how many times a day you're testing, and we can help then. Bottom line, we can see how often you're filling your prescriptions for both medication and testing supplies, and if things change, it's easier to communicate with one another when your doctor and your pharmacist and you are all in the same room together, as opposed to being all over the place. So with that, you get your meter and your strips, of course, and lancing device and lancets, some control solution, and then also alcohol pads for those that like to swab their finger or wash them. All of that for free.
So what if I have insurance? Would I still get the free monitor, or do I need to use my insurance? How does that work?
It really depends.
Okay.
There are some insurances that are wonderful, right, where they cover things and things are at no cost. So there are some plans out there where they might have a particular meter, and we'll do that meter then.
Okay.
Again, it's no cost to you. You're still going to one place for meds and supplies, which is win-win for everybody. But for the majority of our patients, they usually do go home with our house brand. It's a very reliable meter. I like the fact that most of our patients have this brand because it makes it easier to troubleshoot and teach how to use it.
Right.
All the different meters out there, they
Yes.
get kind of particular in their setups and which buttons to push and when.
Right.
So yeah, it's a very reliable meter, and if there's questions, we can help a little bit easier, just because it's consistent.
All right.
Yeah.
So that's really all I have.
Yeah, maybe we'll stay live for just another minute or two in case there is a question out there. I don't know about you, but I tend to wait until they're about to hang up. And then I'm like,
Right.
oh, but can you, I just have one team question if it's not too much trouble. That's, that's me being a little bit shy inside sometimes. So, yeah.
Okay. This is exciting though. I'm just real thrilled that we can share, because sometimes it's hard to get this kind of stuff out there. I'm not a real fan of doing stuff like this live, but it didn't hurt.
Yeah.
Yeah,
I think we got most of the information. We're
so.
probably gonna go back and maybe put some side comments in there about things we maybe said, oh no, I forgot to say this. That's the hard part about being live.
Yes.
Yes. You can have all the notes you want in front of you, and sometimes it's still, you kind of miss it because you get caught up in the moment of something. But yeah, like you said, it's just nice to be able to have another way to give people information.
Right.
We try to do as much advertising or marketing, if you will, on all of the resources we have and all the initiatives, and yeah, I was looking at Grace Health's Facebook page, and just noticing all the helpful hints with taking care of yourself that is put out there. Everything from how to lower your blood pressure, the importance of knowing your status, if you've been tested for HIV or hepatitis C perhaps in your lifetime. Just all sorts of little gems.
The COVID information and how we are making sure patients are safe when we working here on site. We have to have masks, and we want to keep it isn't just for our protection, but it's for our patients as well. We want patients to feel safe when they come into Grace, and because this is a healthcare facility, we want everybody to be safe.
There's definitely some patients that opt for home delivery because of that. They don't want to come in.
Good point.
They want to stay home. There's a lot of reasons people do home delivery, and it's not just transportation or gas price related.
Right.
Sometimes it's because they're nervous to be out in public.
Right.
Yeah. Just trying to make sure everybody gets the health care they need, and that it's not too hard. It's doable, manageable.
All right. Well, I think we're good.
I think we'll say that this was a nice chat with you all. I again thank everybody for tuning in and listening to the information. If there's something you want to hear again, by all means, this will be recorded and posted.
Right.
And please do share with those you think need to hear it as well. And contact us if you have questions.
Absolutely. All right.
Thank
Thank
you.
you. Oh, if you end this live video now, you'll be able to choose if you want to save or delete it.
Just please save.
It did. Okay. Maybe we have to end it.